Good afternoon, everyone. Today, I'll be updating Manitobans on the work we've been doing to connect even more families with childcare options as part of our COVID-19 response. What we have seen so far can be summed up in one phrase. We've seen heroes helping heroes. We are incredibly grateful, as are all families across our province, for childcare centres and homes that continue to open their doors to families during this pandemic. This is a challenging time for all of us, there's no question, and that's no different for Manitoba childcare providers. They're juggling the challenges of a changing response to this unprecedented pandemic and working to meet the expectations set out by public health recommendations while maintaining their dedication to children and families and being responsive to the concerns and questions of their staff. What we have seen in the past few weeks is their willingness to go above and beyond, to reopen their doors with a smaller number of children to meet the childcare needs of critical and essential service workers. From all of us, I want to say to you, thank you. Your continued efforts have not gone unnoticed or unappreciated. But we still need more childcare facilities and early childhood educators to answer the call during this difficult time to be a part of our province-wide response to COVID-19. So far, we have matched over 1,900 healthcare and other emergency service workers with childcare. We continue to match any remaining parents with childcare over the next several days before expanding to all critical service workers beginning next Tuesday. At that time, all parents who work in critical services and who can't find other childcare arrangements will be able to check with which facilities have spaces on our website. Then they can reach out to make childcare arrangements that meet their family needs. Nous lancerons un site web demain où les parents pourront rechercher les services de garde disponibles et à partir de mardi, ils pourront contacter les centres directement pour organiser la garde des enfants. Our government continues to support the childcare sector by providing over $30 million in operating grants over the next 3 months. I have also confirmed with the Federal Minister of Families, Children and Social Development that childcare centers are eligible for the federal emergency wage subsidy, which provides up to 75% of employee wages for businesses and not-for-profits. If you are a childcare center who is considering reopening, please use the resources at your disposal to do so. Your dedication and willingness to provide care is an essential part of our fight against COVID-19. Early childhood educators who want to explore providing care independently can also take advantage of the $18 million grant program we've made available. You can access it by applying online. I also know that many Manitobans have questions about precautions in our childcare centers and home-based providers to protect the health of children and workers. I can assure you that we are consulting with our Chief Provincial Public Health Officer every step of the way when it comes to these issues. Updated guidelines to prevent the spread of the virus in our childcare facilities will be distributed by Dr. Roussin to the entire childcare sector. Social distancing may be difficult in a childcare setting, but I am confident that centers that follow the guidelines to be circulated by Dr. Roussin will continue to be safe to operate. What we have been saying to everyone also applies to childcare. Wash your hands frequently, cough or sneeze in your sleeve, and stay home when you're sick. And parents are reminded that children experiencing cold or flu-like symptoms have traveled outside the province in the last 14 days or have been exposed to others with a confirmed case of COVID-19 cannot be dropped off at a childcare facility and should remain at home. Like many families across Manitoba, I'm looking forward to the launch of expanded eligibility for childcare services, and we will continue to support our heroes who are helping the heroes in our healthcare and other critical services during this time. Thank you to everyone who has risen to the challenge. We're all in this together. I'm happy now to take any questions that you may have.
Thank you, Minister. A reminder to the reporters online, one question each, and please introduce yourselves. From CBC Manitoba, Nicholas.
I don't have any questions at this time.
From the Winnipeg Free Press, Eva.
Hi, this is Eva Wozni from the Winnipeg Free Press. You mentioned that you're still looking for more child care spots to open. Can you shed some light on how many child care spots have reopened and how many you need to fill the need that might come up next week as these eligibility is expanded to all frontline workers?
Yeah, well, thanks, Eva. It's a great question. Certainly, we can get you the individual numbers, but what I do know is that we've been able to place almost 2,000 people who have needed childcare spaces in childcare facilities in the province. And what I do know is that we've been able to place well over 90% of those who work in healthcare alone. We've been able to match them with the childcare facilities that they need and other essential service workers, critical service workers as well. So we will be expanding that list, and we over the weekend, and we will be providing and matching those critical service providers who need childcare. We'll be able to, through the websites that we will be launching tomorrow, they will be able to access that website to be able to see where the spots are available. So, and that will be up to the individual who, a critical care worker or critical services worker who needs the space. They will work directly with those facilities. So we still are encouraging other facilities to open up with the Dr. Roussen's recommendation of up to 16 childcare spots, and we'll continue to work with those childcare facilities towards that end.
From Global, Kevin.
Hi there. So you mentioned, I believe 90% of healthcare workers have a spot secured for their child. We heard yesterday from the province that I believe 20 healthcare workers had contracted the virus. Is there protection for staff, I guess with the risk of kids maybe picking it up at home and then coming to the daycare? Is there any sort of protection in place for staff or protocols so that they're protected? Do they have any equipment on hand? What's kind of the protocol there?
Yeah, great question, Kevin. And we know we've been working with Dr. Brent Roussen every step of the way throughout this process. He has actually put together the COVID-19 early learning and childcare practice guidance guides that will be sent out to all childcare facilities. So in that, it indicates all of those protections and precautions that should be taken and addressed within each childcare facility. And he's also offered to meet with them and answer any questions that they may have as well. So, we will continue to rely on the advice of the Chief Provincial Public Health Officer and move forward with him. And I just want to thank him for all of the work that he's done so far.
From the Brandon Sun, Michelle.
Hi, yes, Michelle Letourneau with the Brandon Sun. I'm just wondering, yes, there are protections and protocols in place. How about the equipment necessary? Will those be going out to daycares that choose to reopen?
Sorry, you cut out a little bit there. Could you just repeat the question?
Yes, sorry. So Michelle Letourneau with the Brandon Sun. Yeah. I'm wondering, yes, I know there are protocols in place that come from a public health officer, but how about the actual physical protection equipment needed? Will those be going out to daycares that will be reopening?
Again, no, thanks. That's great. Thanks for the question, and certainly we'll again continue to work with the Chief Provincial Public Health Officer. He has put together that practice guide for early learning and childcare facilities and operators. So we'll continue to take his advice, and many of those things I've already mentioned today, the precautions that take place with washing your hands, coughing in your sleeve, all of those kinds of things will be a part of that as well.
From CJOB, Diana.
Good afternoon, this is Stefanson. It's Diana from 680 CJOB. Kind of similar to Eva's question. Obviously, you mentioned that 90% of healthcare workers have been able to find childcare for their kids. But how many more spaces are we looking for? Again, you've given us numbers on how many's been matched, but do you have a range on how many more you're after?
Yeah, no, great question. And, again, that depends on how many people come forward. Now we're putting a call out there to the critical service workers who need childcare. So it depends on how many of those sign up. And obviously we want to ensure that they get the childcare that they need. They're doing tremendous work for us during this COVID-19 pandemic, and we want to ensure that we do our part to make sure that they get the childcare they need so they can get out and do the incredible work that they are doing to help with the safety and health of all Manitobans.
From CBC Radio Canada, Ezra.
Hi, Ezra Bercuino from Radio-Canada. First, thank you for the French comment. Here's my question. After the province's decision to close the daycare as part of the measures to prevent the spread of COVID-19, you recommended to the daycare providers not to make parents pay during this period. But we have a French daycare center that requires parents to pay, otherwise their child will lose their place. One of the parents received an exclusion letter yesterday for opposing the daycare's decision. What do you think and what guidelines do you give to these parents who feel threatened and abused, but also guidelines to the daycare, please?
Thanks. Great question. And certainly, we deal with things on an individual basis with respect to individual childcare centers on a regular basis. And this is one of those where the department is working closely with the situation. What I will say is our government has urged childcare facilities not to charge parent fees to parents who are not accessing those services. So we continue to say that. Je tiens à remercier tous les travailleurs des services de garde d'enfants qui se sont mobilisés pour fournir des services de garde aux travailleurs de soins, de santé et des autres services d'urgence. Vous êtes vraiment des héros qui aident les héros pendant cette période difficile.
Thank you, Minister, and that concludes today's media briefing.
Thank you, and happy Easter and happy Passover.